The time, 7:15. We know that significant numbers of Conservative MPs are planning to vote against the government's plans for new COVID restrictions in England, including compulsory masks in public places and vaccine certificates for some settings as well. The former Brexit Secretary, now backbench Conservative MP, David Davis, is here in the studio. Morning to you.
Good morning.
Which aspects of the government's plans are you intending to vote against, or indeed all of them?
No, I shan't vote against the mask requirement. I mean, I think, frankly, most of the public are wearing masks anyway. My own journeys north and south suddenly changed at the beginning of last week or middle of last week when it went from about 30% of people wearing masks on the tube and train to nearly 100%. So that's not an issue. The real issue here is the so-called vaccine passports, the COVID certificates that you have to have, there are two reasons for that. One is it's an illiberal requirement. It's not something we have historically done, required people to document their own medical status. But the other thing, and much more important in many ways, is that actually it won't work. It's been tried in a number of other countries. France from the summer, German states, Greece, Scotland, Wales have all tried, and they've all tried to actually validate that they've done it and it's had an effect, and none of it stands up.
Doesn't it
you
work
can understand
in this way?
Why?
No, but doesn't it work in this way, that it persuades people that if they're going to go to these settings, they might think, oh, well, I'll get vaccinated because I want to go to the settings. In other words, it marginally increases the numbers of people vaccinated, never mind what happens in the setting itself.
Yeah, well, there's not much evidence of that, but frankly, that's a slightly dishonest way to approach this. What's been said by people like Michael Gove, for example, is this is your duty to protect everybody else. But what we know about the vaccines is they're quite good or very good at protecting you. From serious symptoms, dying, and so on, but they're much less good at stopping you catching and transmitting disease to somebody else. These modern vaccines are different in that respect, and that gets worse over time. After about 3 months, after 12 weeks, at least one study has shown that actually I'm triple vaccinated, but after about 12 weeks, I'd be no less likely to transmit the disease than somebody who's unvaccinated. Now that's really serious because I won't have any symptoms. I think I'm vaccinated. If the government gets its way, I'll have a certificate saying I'm vaccinated. So I'll think, fine, doesn't matter. And actually, my behaviour pattern will probably make my likelihood of promoting the disease worse, not better.
The booster programme, much trumpeted, of course, by the Prime Minister last night, trumpeted on this programme this morning. We're going to talk to the Health Secretary at 8:10. What some people say was, hang on a second, we could have been doing it for some time.
I agree, I'm afraid. I mean, the first time I heard the million jabs a day phrase was in September. And actually, that was the right time. If you look at, we don't have to guess anymore. Look at last year. The COVID infection rate took off in late September. Death rates took off in October. That's classically the case for respiratory diseases. All respiratory diseases get worse in the winter. So why weren't we doing this? If this was so important, why weren't we doing this in September?
Well, I suppose what the government said, two things. Number one, we didn't have Omicron, did we? That would be their response.
Well, if you'd had an epidemiologist or a medical expert in this studio in August or September of this year, and you'd ask them two questions. One, are we likely to have more new variants above and beyond Delta? The answer would have been yes, very likely. The second question, is that variant likely to grow at exponential levels, at exponential rates? He would have looked at you like you're a first-year undergraduate, because they all do. That's what infectious diseases do. So what's new? I mean, the only thing that's new actually about Omicron, well, there's two things new about Omicron. One is the sheer level of the infectiousness, fine. It's doubling every 3 days, that's pretty fast. And the other thing that's new about it is it's actually less, it seems to be, on the South African evidence at least, less harmful, not significantly less harmful than the previous variants. But the truth of the matter is, the actual problem, we were always going to face a challenge. And if you'd asked the NHS people who were talking to you earlier, how much of a challenge can they take, they would have said very little because they're trying to catch up on what's gone before. They've got no spare capacity.
But then if the government had gone ahead...
why didn't we do it in September?
Well, because of all the other things those NHS people were saying, which is that the NHS is severely damaged, is not capable of providing vaccines at this level, and also all the other treatments that it has to.
Well, what actually happened, from my memory, and I'm now talking from memory, so forgive me if I've got this one or two out, but my memory of it was that the actual rate dropped to about 58,000 a day. 58,000, not a million, from approaching 500,000. And bear in mind, of course, the NHS is under pressure, but a lot of this is about recalling retired doctors and nurses, about using other facilities, town halls, getting companies to inject. That doesn't impact on the GPs, that doesn't impact on the hospitals. It simply impacts on logistics. And actually, to be fair to the government, they've done a very good job on getting the vaccines available. But we've had, I've been reading headlines about us having surplus vaccines that we should be sending to the third world. If we've got those surplus vaccines, why haven't we used them?
We will be putting all of this to Health Secretary 8:10. David Davis, thank you very much.